Welcome to Thursday's edition of COVID-19. There has been a decline in the daily tally here on the local front, and we have more on this fall first before touching upon the role that Korea is poised to play amid its recent vaccine partnership with the US. We start now with the pandemic updates with our Kwon So-ah. So as I just mentioned, there has been a drop in new cases here in Korea.
Well, yes, Sunny. Following a hike on Wednesday, this Thursday, we are seeing a drop by almost 80 cases to 629. And that's 620 domestic transmissions and 9 imported cases. And for the first time in 7 months, we're seeing this figure in the single digits. And 3 deaths were reported in the past day, while the total number of cases now stands at 138,311. A slight drop in the cases has been reported here and there, including in the capital region, but still we are seeing all corners of the country being affected, even this corner here, Jeju-do Island, with 26 new infections. Now, Korea remains under the 4th wave of the virus, with infections hovering between the 500s and the 700s, and with that, the average number of daily cases stands at 599, and that average for domestic transmissions is 576.
I see. Meanwhile, so on, our vaccination drive is expected to pick up pace, with more elderly people receiving their doses on this Thursday.
Right, Sunny. That's the age group from 65 to 74, as well as people with respiratory diseases, and they will be administered with the AstroZeneca vaccine. A little under 70% of seniors aged 70 to 74 have pre-registered for their vaccination, and less than 64% for those aged 65 to 69. Now, also beginning today, or since 1 p.m. to be exact, reservations for no-show vaccination has become much easier, as it can be done via Korea's major portal website as well as mobile messenger service. And to minimize leftover vaccines due to people who do not show up for their vaccine schedule, real-time information is being provided by Naver and KakaoTalk on where in your neighborhood you can immediately get a shot. Anyone born before 1992 can use the service. As for now, only AstraZeneca vaccines are available for no-show vaccination, which in Korea is being administered for people aged 30 and above. And so far, 4 million people in the country have received at least 1 shot of vaccination, and the number of people who got their second dose has also surpassed 2 million. Now, despite a slower vaccination completion rate than in many other developed countries, South Korea was ranked 5th, going up a place from April in a COVID-19 resilience ranking by Bloomberg, just behind Israel. New Zealand, Singapore, and Australia came in 3rd, while the UK and the US both went up 7 and 4 spots respectively to 11th and 13. Now, South Korea's low fatality rate has been attributed as one of the reasons, while it is one of the best places to live among the pandemic. And now let's take a look at the figures abroad. I just mentioned that the UK went some spots up in that earlier ranking, but here with 4.4 million cases in total and almost 3,000 new infections in the past 24 hours, this is due to a spread of the Indian variant there. And the total number of cases around the world now stands at 169 million. And those are the updates I have for now. I'll be back in a bit after the government briefing. Sunny?
All right, so thank you for now. Up next, as part of efforts to rally public support for its vaccination campaign, the government has unveiled a comprehensive plan of incentives. For more on this, I have our Yoon Jung-min here in the studio today. Hello, Jung-min.
Hello, Sunny.
Right, then let's start off with the planned ease in prevention practices for those vaccinated.
Sure, Sunny. So the government aims to ease social distancing guidelines in 3 stages so that larger groups of people can meet for private gatherings. Well, if you take a look at our graph here, South Korea aims to inoculate 13 million people by June. For those who have gotten their first COVID-19 vaccine shots, they can hold family gatherings with more than 8 people 2 weeks after getting their shots. From July, vaccinated people will not be subject to attendance limits at private gatherings, including religious services. And they will not be required to wear a mask outdoors except at large rallies. From October, we can expect a broader easing of social distancing restrictions, including the lifting of indoor mask mandate, possibly from December.
Based on how effective the vaccines have been, the government plans to adjust its social distancing guidelines in phases and provide vaccine incentives to help people return to their normal lives.
To encourage more people to get vaccinated, the government may also offer discounts on entrance fees at public facilities. People can get a hard copy certificate or digital proof on their mobile phones after getting vaccinated, which they can use to receive these benefits. The government, however, may reconsider offering these incentives if they fall short of their inoculation goal. But there are concerns too. Some say that it may not be easy to distinguish those vaccinated from those who are not in crowded areas with a large number of people. The health authorities dismiss concerns over the lifting of mask mandates, saying that even getting one vaccine dose significantly lowers the risk of transmission.
I see. Perhaps then there are lessons to be learned from countries that have inoculated a large number of their population.
You're right, Sunny. So in the U.S., a number of companies are changing their masking policies following a new guidance from the CDC. Well, they include Starbucks, Walt Disney, Walmart, and Costco. Starbucks says it will make facial coverings optional for vaccinated customers. Walt Disney has announced that masks and face coverings will be optional in outdoor common areas at the theme park with some exceptions. This follows an earlier CDC announcement that fully vaccinated people don't have to wear masks nor practice social distancing when indoors or outdoors. State governments, including Hawaii, have also started easing restrictions after vaccinating a large number of residents. We'll take a look here.
You will not be required to wear a mask while outside. However, we do strongly encourage everyone when they are outside in large groups to continue to wear a mask. The mask mandate is not changing indoors.
Well, in Israel, its health minister announced on Sunday that from June, almost all COVID-19 restrictions in the country will be lifted. The minister added that the country may no longer need the green pass to a permit to access indoor venues for vaccinated people or those who've recovered from COVID-19. However, people in Israel will have to continue wearing face masks when indoors. Israeli health authorities say they will maintain restrictions regarding entry into and departure from the country to tackle the threat of variants.
And staying with face masks, Chungmin, I understand some experts are calling for caution with regard to efforts to lift this mandate.
You're absolutely right, Sunny. So a top official from the WHO says, well, individual governments must carefully assess their local situation if they plan to lift mask mandates. Well, take a listen here.
Instance of a country that wishes to reduce or take away a mask mandate or take away other measures of public health and social measures, that should only be done in the context of considering both the intensity and of transmission in your area and the level of vaccination coverage.
So they are saying that it might be too early for them to allow people to take their masks off.
I see. All right, Chungmin, as always, thank you very much for the coverage.
My pleasure.
Right, we are now poised to join the regular briefing on the COVID-19 situation here in Korea for this Thursday. Right, now, despite the slight decline in daily tally today, authorities are calling for strict adherence to prevention measures and to refrain from unnecessary social ventures outdoors. Also starting on this Thursday is the opportunity to register, as Soa mentioned, for no-show or surplus vaccines of the day. Now, the online app is available via the Naver and Kakao platforms and open to all those who are eligible for COVID-19 inoculation. We are still waiting for the briefing to start, so let's take this moment to remind ourselves about the possible discomforts after COVID-19 vaccination. Common side effects include pain at the injection site, fatigue, and headaches. Now, with regard to ways to minimize discomfort, here are a few natural remedies. Try applying cold cloth or pack on the injection site. Right, the briefing's about to start. We'll come back to you afterwards.
먼저 브리핑 설명이 있겠습니다.
First of all, let's have the explanation on our briefing today. I am from the COVID-19 vaccination task force, and let us now begin our regular briefing for today. Today's May 27th, Thursday. And first of all, here are some updates on our COVID-19 vaccination rollout. Starting from today, we have been rolling out the vaccine for senior citizens aged over the age of 65 and between the age group of 74. And the total vaccination rate, booking rate for the senior citizens stands at about 62%, and these processes will continue until June 3rd. So if you have completed this booking process, please visit your designated hospitals that you on the day that you have made the reservation for, and please get the vaccine. And if you have not done so, please also make the booking as soon as possible. And we are providing the vaccines to the designated hospitals nationwide. And as of yesterday, we have about 4 million people, over 4 million people who are receiving at least one dose of the vaccine. And also we have about 2 million people who have received both shots. And starting from today, as we roll out the vaccine for those over the age of 65, we believe that these numbers to significantly increase daily going forward. It is very important that we highlight the importance of vaccination for the senior citizens. And please also note that the disease is especially deadly for these age group, with about causing 5 fatalities out of every 100 people. However, even a single dose can significantly reduce the risks of the infection and also reduce the risks of fatalities. So if you have parents who are senior citizens, please also encourage them to get vaccinated. And as for the senior citizens aged over the age of 75 who have not good access to the vaccination centers, you can also visit the designated hospitals or the public health facilities in your neighborhood to get the AstraZeneca vaccines. And starting from today, we believe that more people will be receiving their jabs on a daily basis. So please note that you need to monitor your health conditions for the next 15 days after inoculation by staying at that specific hospital. And even after you return home, please take good rest and please take good care of your conditions and watch your symptoms for the next 3 hours. And also for the next 3 days, please monitor your situations to check if you have no other symptoms like high fever or so. And if you have these adverse responses, please visit a doctor as soon as possible. And you could also have discomforts, including light fever, nausea, or headache. However, please note that these are common and these may fade away after a few days. So if you are experiencing such common symptoms, please take a good rest and also take some abundant amount of water and also take some painkillers as well. And as for the younger generation, we see that these side effects or these adverse responses could appear on a more frequent basis. So please prepare a painkiller in case you have these symptoms. And as for the vaccine supplies, today we have been supplied with more than 1.06 million AstraZeneca vaccines. And currently we have about 18 million doses that have completed the distribution across the country. And also tomorrow as well, we also have scheduled AstraZeneca vaccines to arrive and about 3.2 million more doses to arrive during the next few weeks as well. And starting from 1 p.m. today, we also have the accessible and easy real-time check on the no-show vaccines, which shows the surplus vaccines in your vicinity. You do so through the Naver or Naver map application or even the Kakao Talk application. So please make yourself available through these applications and these services. You could select select, or you could also register 5 hospitals, and you could also receive alarms on whether these hospitals have some leftover vaccine doses available. And as for the Pfizer vaccination centers, we will be expanding the vaccination centers. Starting from July, we believe that Pfizer vaccines can be also rolled out at the designated hospitals nationwide. And we have been receiving some demands, and also out of some 13,000, we have selected some 1,500 of them to be designated hospitals to roll out the Pfizer vaccines, and they will also be providing the vaccine starting from July. And next, as for the compensation committee for the vaccination, we have had the latest round of meetings of screening, and we have looked at the cases of these compensation cases, and we looked at the adverse responses. And please note that this committee includes and comprises of experts in various fields, and also there are 15 experts who have been recommended by lawyers as well as the civil society. And they also stand independent from the government's quarantine authorities. And we had the second round of these compensation meeting, and we looked at the small cases, about 160 cases of those that have about 30 million Korean won for the compensation. And we also looked at about other dozens of other that have more higher rates of the compensation amount. And we have been doing a comprehensive screening, and they also include many symptoms like fever or allergic reactions like anaphylaxis, and we agreed to provide these compensation for about 165 cases. And globally, out of the 194 WHO member states, about 12% of them, they have these such similar state-run compensation committee, and they also take a look at the severe cases, and most of them provide only compensation for severe adverse responses. We are also abiding by these international norms and standards. However, we are expanding the scope of such compensation so that we can increase our responsibility against these adverse cases. And we have lately also provided our treatment fees for those who have suffered from adverse responses after inoculation. And right now we have selected 7 people who could receive about 10 million, up to 10 million Korean won, and they will be provided as soon as possible. And we also have been looking at the inevitable side effects that may accompany the vaccination. And as for these, we will make sure that we have a swift compensation rolled out as soon as possible. We will also monitor the global trend and international trend of such side effects being reported globally, and we will also expand the scope of compensation going forward. So we ask you to also have a minimized nervousness or anxiety over the vaccines, and we will also exert our best to this end. And next, as for the COVID-19 trends at major countries, we have some updates. Globally, on a weekly basis, for the past 3 weeks, we have seen constant decline. However, we still see many countries in Asia seeing a increase in cases. In India, for example, we also have seen an increase of fatalities, and we also have increase of cases in Vietnam, Malaysia, and also Taiwan. And as for Taiwan in particular, we are seeing also record daily cases as well. However, in countries that have a high number of vaccination rates, we are also seeing a steady decline in the number of daily tallies, and these include Israel, France, and the US, and so forth. And once again, we highlight multiple times, however, it is very important that we return to a state of normalcy through vaccination. This is the only way possible. And as we roll out the vaccines, and as we continue with our booking process until June 3rd, please take use of this system and process and get the vaccine vaccination on the reserved date. We once again highlight the importance of vaccination for these senior citizens. The efficacy shows that vaccination can reduce the risks of infection, and even if you are infected, you could also reduce the risks of fatalities, and you can also reduce by almost half the transmissibility as well. So it is very important and crucial. Starting from today, we will be rolling out the vaccination to a large public, and we believe that we will have many more daily people who will be receiving these vaccines, and we believe that this will be also accompanied by an increase in the number of adverse responses that will be reported. However, please note that you could also experience these discomforts for the next 2 days or so, but also please do not have such nervousness or anxiety over these vaccines, but please note the importance of individual vaccination in order to enable a healthy society. So please also vaccinate yourself if you are the eligible recipients, and please also encourage your parents to do so as well. And until we reach herd immunity, please wear your face mask, please ventilate your space, and also please make use of the basic quarantine rules as well, including social distancing measures and testing on a regular basis. And please note you need to always wear face masks indoors, even after inoculation. The government will also exert our full efforts to this end. Thank you very much.
네, 지금부터 기자님들 질문에 답변드리겠습니다.
Right, that was Kim Gi-nam with Thursday's afternoon briefing. So what did he have to say?
Well, he forecasted that daily inoculations are expected to surge from now on because the vaccinations for elderly people has begun today. And also he had an update on the vaccination registration rate, which has surpassed 70% for those aged 70 to 74. And for the age group of 60 to 74, that percentage stands at 62%. And also he reminded people that the vaccination registration will continue until June 3rd. And for those people who are going to the vaccination centers, they should make sure to monitor their condition for 15 to 30 minutes after getting vaccinated. And also there's some more updates on vaccination supply, such as recently over 1 million AstraZeneca doses having arrived in the nation. And also Pfizer vaccination centers are expected to be expanded with the general public to get vaccinated with Pfizer as early as in July.
I see. All right, so as always, thank you very much for that. Coexistence with nature depends on commitment to green ways of living. In this fourth installment of our special series on the 5 arenas for global action, we touch upon the fostering of sustainable cities. Do take a look.
Building green cities is another key pillar of the P4G Sustainable Development Goals. During the 2018 P4G Summit in Denmark, a wide variety of new mobility solutions were discussed to facilitate green growth and greener cities. The P4G will explore this concept further during the upcoming summit in Seoul, envisioning an entirely new urban landscape in the form of smart cities. The city of Sejong, located in central Korea, is one of the country's leaders in the smart city revolution. Autonomous driving technology is a key focus, designed not only to improve the safety of drivers and passengers, but also to put Korea on the eventual path of net zero carbon emissions.
저희 차량 자체가 GPS 기반으로 가기 때문에 지금 GPS가 이제 경로를 찾고 있는 거고요. 이 차가 전방에 이제 센서가 2가지가 있는데 그거를 이용하여 이제 앞에 물체가 나타나면 이제 멈추기도 하고 멀리 있을 때 천천히 멈췄다가 지나가면 다시 출발하는 그런 구조로 되어 있고요. 이게 이제 라이더 앞에 센서나 옆에 센서를 봐가지고 이렇게 수비나 이런 걸 인지를 해가지고 장애물이 있나 없나 그걸 확인하는 그거고요.
The main focus of smart cities in the past had been all about convenience and cutting-edge technology. But now they're being viewed as a means to solve chronic issues that have long plagued urban areas.
자율주행 차량이 예전에는 어떤 개인 차량만으로 개발이 집중이 됐었는데요. 현재는 자율주행 셔틀이나 어떤 물류 로봇이나, 그러니까 이제 공공 인프라에서 여러 사람들이 같이 쉐어링할 수 있는 그런 서비스로 많이 발전이 되고 있고요. 그렇게 되면은 예를 들어 셔틀 같은 경우는 노약자나 교통약자 그리고 몸이 좀 불편하신 분들 그분들 위주로 좀 더 상용화되지 않을까라는 생각을 하게 됩니다.
The Living Lab project, launched by the city of Sejong, has also caught the attention of its residents. It provides Sejong residents with an open invitation to get directly involved in the planning, execution, and feedback of smart urban services.
신호등이 없는 부분에 그 횡단보도를 좀 안전하게 건널 수 있는 신호등을 대신할 수 있는 대체 시스템이 있을까 그런 생각에서 무신호 구간의 횡단보도 보행 시스템 이런 의견을 냈었고 그리고 신호등이 없는 공간들이 보통 우회전을 하는 경우에도 신호등이 없어요. 우회전 안전사고도 많이 있잖아요. 우회전 구간 안전사고 방지할 수 있는 시스템 그리고 쓰레기 무단 투기를 방지하는 그런 시스템들 다양한 의견들을 제시한 바 있습니다.
가능하면 스마트시티는 똑똑한 도시를 추구하지만 기술만을 위주로 하는 도시가 되어서는 안 되고요. 그 도시에 살고 있는 것이 바로 그 도시민들의 자부심이 될 수 있는 품격 높은 도시를 만들어가는 노력이 필요하다고 볼 수 있겠습니다. 그런 측면에서 이런 P4G라든지 다양한 행사들을 통해서 시민들이 참여하고 관심을 갖고 서로 협력하는 그런 도시의 모델을 우리나라가 좀 만들어갈 수 있지 않을까 이렇게 생각합니다.
Cities are the central hubs of transportation, energy, and water networks, and each face a different set of challenges determined by their own unique environment and other factors. And we must change the way we plan, build, and manage our cities in order to create a sustainable habitat for humanity that can last for centuries and more.
이제 미국과 한국은 글로벌 백신 수요에 효과적으로 대응할 수 있는 생산 기지를 확보하게 되었습니다.
국내 mRNA 백신 원천 기술을 조속히 확보하는 데 많은 도움이 될 것으로 기대합니다.
Korea is seeking a greater presence in the global supply of COVID-19 vaccines. Accordingly, pharmaceutical firms here are scrambling to set up high-tech manufacturing facilities that some pundits believe could fuel the future fight against disease. For more on this, I have Dr. and Professor Cecile Serkinski from the French National Institute of Health and Medical Research. It's good to see you again, Professor Serkinski.
Happy to be with you, Sunny.
Right, and I also have Dr. Kim Sing-taek from Institute Pasteur Korea. Welcome back, Dr. Kim.
Good afternoon.
Right then, Professor Serkinski, let's begin with your thoughts on the recent vaccine partnership signed between Korea and the US and its potential role in the fight against COVID-19.
It bodes very well. It's good news. Korea needs some help. But I would say that MOUs, bilateral partnerships, pledges of that kind are only meaningful if you lift a number of obstacles. And one of the foremost is the US Defense Act that prevents the supply of raw materials and products necessary to make vaccines. So that need to be lifted if you want those agreements to be meaningful and fully supportive.
A very valid point, of course. Meanwhile, Dr. Kim, Samsung Biologics will be manufacturing Moderna's mRNA vaccine, while SK Bioscience is manufacturing AstraZeneca and Novavax vaccines. What can you tell us about the difference in manufacturing, in the manufacturing facilities, that is, for the mRNA vaccine of Moderna, the vector vaccine of AstraZeneca, and the protein subunit vaccine of Novavax?
Well, like you said, the three vaccines actually using the different kind of the platform technology. For the mRNA-based vaccines, it's completely new just technology, and then it is very important to just maintain just cold chain. And especially now, just a normal laboratory working with the RNA, it is very just routine for us to just maintain for like a very low temperatures, even for like a storage minus 70 degrees because the RNA itself is very unstable. So this is going to be just a challenge for just maintaining just a cold chain while just manufacturing itself. And then other than that, I think it would be pretty good, but I think the AstraZeneca and Novavax, that does not need any such kind of a very ultra low just cold change. So it's based, as you said, the virus, the vector vaccine, and then the protein-based vaccine. So it will be much easier to just maintain the temperatures and then storage and then delivery, things like that.
Right. And Professor Sierkiński, before we touch upon the huddle that you mentioned earlier, first of all then, these manufacturing deals that Korean companies have managed to sign with their US and other country counterparts, what do they tell us about Korea's bio-production capacity?
So, good point. I add something on my colleagues is that when you refer to the Moderna Samsung deal, it's not a manufacturing deal, it's a fill finish deal. So it's the last step of the embedding of the product. Okay?
You mean the drug product business?
Yeah, so this is not purely a manufacturing deal, a production deal. It's a fill finish, which is the last step in the confection of a product, be it a drug or a vaccine, that consists in just filling vials, capping them, and packaging them. So that's what the Samsung Moderna deal is about. Moderna still maintains its strategy, that is beef up its own production domestically and just ship bulk material to be filled and finished. So it's not a real full-blown manufacturing agreement. I had it. Your question, what makes Korea so appealing? Number one, it's because it has documented expertise in vaccine production. You have very big successes. Remember the hepatitis B vaccine, recombinant hepatitis B vaccine, which was among the first ones that Korea contributed to the world. It was even the cheapest, so it's already one big success story. Korea has produced tetravalent influenza vaccine domestically entirely. It has produced other vaccines. So Korea has a tradition of manufacturing high-quality products. What makes Korea appealing, especially now in the context of COVID-19 vaccines, is that it is a small country with a relatively small domestic market, 52 million people, and is capable of producing massive amounts. We're talking about hundreds of millions, if not billions of doses. Now, you have to compare it with what is comparable. Who are those? That would be India. That's the world's largest supplier. But India has to respond to its own domestic demand, which is colossal. And you've seen what happened in India, where the government took the decision to prevent export of Indian manufactured products, which means is the largest producer in the world. So it gives Korea already a very, very strong appeal, in addition of being a country with documented excellence in drug and vaccine manufacturing.
Professor, going back to your point about how the deal between Moderna and Samsung Biologics is a drug product business, that's a fill and finish deal, do you suppose that the Samsung Biologics has the capacity then to produce drug substances for Moderna?
I think so. I don't know in detail the research and development program, but beyond Samsung, you have companies and organizations in Korea that are fully capable of producing what you call a drug substance, that have strong research and development activities, and that have good products. I mean, you name you have even a domestically produced COVID-19 vaccines by SK Biosciences. That's testimony to the capability of Korea to produce drug substances and full-fledged.
Right. Dr. Kim, there is belief that the recent partnership, though, between Korea and the US will give Korea the chance to harness a game-changing technology to ensure global health. What are your thoughts on this?
You mean in terms of the vaccine?
Yes.
Well, I know there seems to be some working group just formation between the U.S. and then Korea among some public officials and then the experts from the private sector. And there's going to be some conversation and discussion among in between those groups. And then I don't know just maybe any details about just some composition and how those kind of working groups will just operate in the end. But it will somehow just invigorate and stimulate some sort of just scientific discussions, which will just stimulate and then probably eventually just promote some advancement of the vaccine production and then development in our side as well.
Dr. Kim, how do you respond to calls for the temporary waiver of COVID-19 vaccine patents?
Well, I know there are many different opinions, depending on which country and then the different leaders. But my personal view is that the waiving the intellectual property right is, I think I favor those ideas. And then I want to just quote what Dr. Jonas Salk said. He was actually pioneer in just developing the polio vaccine. And once he said, he actually just abandoned any intellectual property right. And then he once mentioned that, could you patent the sun? I think he actually somehow regarded this kind of a thing as some public good. And I think personally, I believe that in the very exceptional, extreme conditions, we need some extreme measures such as like this. But I know that there are some other opinions from other side, but this is my my view. Yeah.
And staying with that, Professor Sirkinski, what is your stance on the issue of briefly lifting the intellectual property rights for COVID-19 vaccines?
You know, from my standpoint, vaccination is a human right. So access to vaccine is. You have to take into account some other aspects. Governments have made massive investments in the case of COVID. That means taxpayers have made massive investments and therefore should be regarded as shareholders of those initiatives. And they have not only made direct investments, but even indirect ones in providing, let's say, funding for research organization, universities, academic, okay. And basically, most of the companies we're dealing with, providers or producers of vaccines, have licensed in intellectual property rights from the public, if you want. Now, as regard a waiver of IP, I'm not sure this is it will do much. On top of that, it takes quite a long time. I mean, we know World Trade Organization decrees have been very rare. I don't think it has an impact. Mandatory licensing would be probably a preferable option.
Why?
Because it will still preserve return for the inventors, the creators, okay, while maintaining, okay, also incentives for the producer. But having said that, and I'll finish on it, the most important aspect is not really this, is how do you license know-how and how do you transfer technology? And technology transfer is now the key issue. You can have whatever patent rights you want, you need to transfer the technology. And at the moment, under the pressure from governments, from the public, vaccine producers are under big pressure and they don't have the staff or the material feasibility, okay, the physical feasibility of sending staff abroad amid constraints already in traveling, okay, to actually transfer the manufacturing technology. So this is the key issue. And governments and various initiatives should form alliances to facilitate technology transfer in addition to waiving IP or ordering mandatory licensing.
Right. Meanwhile, Dr. Kim, I'm sure you'll agree that in order for Korea to cement its presence perhaps as a vaccine hub, it needs to develop its own vaccine. Having said that, where do we stand on that front?
I know several companies actually started some clinical trials. For example, 5 companies, and not 3 different platform technologies. One is based on the recombinant protein. I think 2 companies are trying just a recombinant protein-based vaccine candidates, and 2 more companies actually trying the vaccine candidates based on the DNA vaccine. And the last one is actually trying a vaccine based on the virus vector vaccine. It's like AstroZeneca and then Janssen, just adenovirus vector vaccine. And then those are currently on the phase 1 or phase 2 clinical trials right now. But there are some other companies, they have already right now started some preclinical trials and trying to prepare for phase 1 clinical trials right now. But in the short-term period, I don't think there is any good chance of those vaccines will be used for people in Korea, because now just the Korean government actually trying to vaccinate people with the vaccines developed in the other foreign countries, like AstroZeneca, Pfizer, and Moderna, in the end, some other Novavax, etc. So we actually just prepare for the vaccines for probably for future pandemic or something else.
I see. Meanwhile, what's the latest on our treatment front then here in Korea?
Treatment front, there is not much progress at the moment, but there are some drugs currently still on the phase 2 or so phase 3 clinical trials, and I think some of them maybe just results from the clinical trials probably will be available within the first half of this year, or at least just within this year, and then some other. That's for the domestic drug candidates we are actually talking about, but for some other foreign drugs, some global trials of phase 2 and the phase 3 clinical trials are ongoing right now for a few drug candidates.
Right, and staying on the international arena, Professor Shkinsky, what can you tell us about the efforts over in France with regard to vaccine development or treatment developments, and perhaps the hurdles they face?
I mean, it's a good question. France, as you know, or if you don't know, is a very highly centralized and hyper-administrative country. That means all the ingredients to favor monopolies rather than diversity. So we don't have that many companies in the land of Pasteur that actually have taken the lead. We of course have Sanofi working on 2 vaccines. One is based on subunit proteins, and the other on mRNA, by acquiring companies, biotech, both in the US. And there's another company, Valneva, that is trying to develop, or at least is in clinical trials now, a whole virus inactivated vaccine, adjuvanted. And we'll say that so far we haven't had luck, especially Sanofi, but they're catching back on the lag. And it's, you know, in this kind of business, you need also a bit of chance. Sanofi didn't have it. Merck, a very large, probably one of the largest in the world, vaccine manufacturer in the US, for example, has abandoned its plans. So that's one of the losers. But Sanofi has now a few plan Bs, let's say, ongoing. And I'm pretty sure that by the first quarter of 2022, France will have a vaccine.
We'll keep our fingers crossed, of course.
Yeah.
Dr. Kim, what then, I understand this is a general question, but what are some of the hurdles that need to be tackled to facilitate the development of a homegrown vaccine?
Currently, for the vaccine development, I think the most significant problem we have to just overcome is the clinical trials. As I told you, there are many people who would be just vaccinated by those that were already developed by the Korean country. So it would not be really easy to secure enough number of people just not vaccinated in this case for clinical trials. And then so for that, there are some other measures that are being actually considered, like some immunological correlative protection. So there are some, I think some globally, there is some movement to understand such kind of a correlative protection, just instead of trying like some large scale of clinical trial, for example, like more than 30 or the 40,000 of people. So that's the one movement. And then, as I told you, maybe some domestic vaccine may not have just a good chance of being used just under the current pandemic. So we need to just consider some use of some future pandemic and other application. So at this moment, it would be very important we just build a bit just a good foundation, and then somehow settle on some basic platform technology to prepare for futures.
Right, and Professor, I extend the same question to you. What do you believe are some of the hurdles that need to be urgently addressed to facilitate the development of vaccines or treatments?
I would say, from the Korean standpoint, what the need is to form strategic alliances, to have manufacturers, Korean manufacturers, bringing in under the same umbrella the various expertise that are needed along the production chain. So you need companies that have excellency in production of what you called before the substance, and you need to have companies that have track record in achieving, that is, transitioning the substance into final product. And that means formulation and fill finish. The big hurdle now when it comes to COVID vaccines is more on the fill finish side. There's not enough capacity. So there need to be alliances, some sort of mutualization of efforts to allow this step to be covered. Formulation is a weak point because most countries do outsource, but within the same geographic area. Okay, in the US, it's US formulating companies. In Europe, it's European. We don't have such formulation strength in the Asian region, and especially in Northeast Asia. So this is where efforts need to be focused. So alliance.
Something that Korea is focusing on.
Yeah.
All right, Professor, thank you very much for your insights. And Dr. Kim, thank you very much for being with us here today.
Thank you, Cindy.
Right, starting today, that would be Thursday, our online app offers those interested the chance to register for no-show surplus vaccines of the day here in the country. Do seek to make most of this opportunity. Thank you for watching.